So my role in the Learning Circle as a municipal rep and as a representative of public health, I see as continuing to remind the participants around the determinants of health. So if you think of the determinants of health, health is only listed once. So it's all those other elements that affect our health that I'm there to remind us about. And at the end of the day, though in a number of cases, the root cause will be what's driving the person to go to the emergency department or have high use of the hospital for admissions. So I'm there continuing to remind us to think about those root causes so that we're not just dealing with the 5%, we're dealing with the next persons that might become part of the 5% and thinking about the upstream components to try and reduce the 5% that we're looking at and the future 5%.
It is extremely important for the hospital to participate in the Learning Circle. Through this, we've had the opportunity to learn about the gaps that our patients experience when they're discharged from the hospital. And this provides us with the information we need to improve the system. We know that when patients leave the hospital, it is a risky time for them, and often there are gaps that occur and they often fall through the cracks in the system. So working together with our other partners can really lead to improvements in the continuum of care for our patients.
The Family Health Team co-lead is actually connected to and in touch with frontline staff, and as such get reported regularly by the complexity of the patients and the difficult and the challenges managing those patients in our units. So why my role is important, because I think I bring a piece of frontline lived experience to the HealthLinks table and to the Learning Circle. Part of that comes from my background, working in an environment where we were able to discharge patients to the community, so I come with some knowledge about how this can be done. And then I also come with the lived experience from the patient side of things. So I think that gives a different level of context of why my role should be important there.
In terms of what's been useful about the Learning Circle, I think it has brought together people from different parts of the healthcare spectrum. At times it's been frustrating, it's been difficult. I think the slow movement at times, as we have had to really come together and develop relationships, and I'd say as well, develop trust. I think it's easier for everybody to come. We all, I think, share a commitment to change, but then how do we take what we're doing and talking about barriers within our within the healthcare system from a group meeting, and we can do that maybe on the level of one patient, but how do we do that and make it broader?
Having the opportunity during the Learning Circle meetings to hear community services providers present patient scenarios has been very useful. It will help our organization determine where gaps are within our system and how we can transition the patient better in the future. So I'm able to bring that information back as a representative of Hamilton Health Sciences to our organization, because we're very much interested in improving the system with other care providers.
Wow, what am I excited about HealthLinks and the Learning Circle? Well, it's the potential for coordinated care. And in a number of the circumstances that we've started to discuss, we began that journey.
One of the outcomes I've been most excited about from the Learning Circle is kind of that aha moment when we actually find out a patient that we've been able to work together and achieve good results. And one of those things is, for instance, with the bed bug. We keep coming back to that story about the bed bugs. The patient, in the midst of all of these complexity in his health issues, the most important priority for that patient was that he's able to live in his home bed bug free. And so despite all of our interventions, the only thing that really mattered was that we gave him a safe home. And that became one of the outcomes I was very excited about.
So what might we change about the Learning Circle and the way in which we're currently doing it? Well, I have to tell you, I think again, the Learning Circle is just a great learning opportunity, coming together of the different disciplines and agencies that touch a person's lives in their journey of health services. But if there was one thing I think that could help us is to find an action item in each one, and each time we come together in each meeting, and then follow up at the next meeting and ensure that we continue to have some tangible results each time we're having a discussion, similar to applying project management principles.
What would I like to see changed about the Learning Circle? In its concept and philosophy, nothing. I love the opportunity, the safe place to sit down and talk to one another, the honesty that's at that table, the understanding that none of us do our job perfectly, and whatever we can learn from each other will only enhance the experience for the patient. So what would I do differently at that table, or how we would change it? I think maybe the opportunity to walk away from that table and actually be concrete about something, and get away from it and say, this is what we're done. But there's so much learning that gets into that I think if we don't take the time to learn how to do it right the first time, we're going to go forward to solution without understanding the problem well enough. So I'm not sure what I would change. I think right now we're still in the stage where we need to learn more about each other.
I think what we want it to be, which is a place where system change can happen, I think that's going to start to happen now. Well, one of the things that I really personally believe has been important has been to move, first of all, to the TriLink structure. So it's not just about one health link, but it's about all of Hamilton. And the other piece about that is then it's also going to be an operations group. So we are in some ways formalizing or putting in a structure where we can have more intentional focus on the change strategies that we need.
Hamilton Central HealthLink was an early adopter, and we then formed the Hamilton West and Hamilton East HealthLinks. What I'm looking forward to is the three links coming together, and that decision has recently been formalized, and working together so that the residents of Hamilton are experiencing similar processes as they cross boundaries within our city.
Where would I like the Learning Circle to go? Well, as I said, the Learning Circle is just a rich opportunity for agencies and disciplines all to come together and share what's important to the patient, the citizen, the client, whoever it is we're serving. If there was one thing that I would see for the way forward, it would be that we focus on the whole system and bring in other participants. And the other participants looking at the other determinants of health and start thinking about as well upstream. What are the primary prevention and promotion interventions that we could implement that will reduce the persons in the 5% and also address the persons that might otherwise become part of the 5% club?